father had a cancer. It was a non-small cell cancer of the lungs with extensive metastasis. Metastases were more in the mediastinum, pleural effusion, so pleural metastasis, liver metastasis. And then he says, can you come and see my father in ICU? ICU में क्या देखेगा, क्या history लेगा, because the whole approach is all to see the reports and see the X-ray. उसमें कोई दवाई का नाम तो लिखा नहीं रहता है ना. Patient is not going to open the mouth and say L, Y, C, O. ऐसा तो बोलने वाला नहीं है. So we came out, went into that visitors gallery and started taking the symptoms of the father. Father was working with Birla Group for many years, and from a very small beginning he went up to the executive board of directors and all those things. He was a great man. Okay? The problem started when one of his daughters died of autoimmune disorders. And he spent all his fortune treating her in America, but there was no result. Since that day onwards, the health declined. Correct? And then he started losing weight. Being doctor's father, every investigation was done normal. Started after some time, hemoglobin dropping down. Doctor's father, so again hematinics and all those things. 6 months this man lost lot of weight. But he was still very active, going to office, this, that. So the son did not have any idea till the case was referred to another physician in Bombay hospital, Dr. Sorabji, and he said, do the whole body PET scan. And when he did whole body PET scan, cancer came out in a very big way. Understood the onset, duration and progress? Understood the ailments from? Okay. Basic personality? Dominating, dictatorial also, Marwari, so very common, they dominate their wives and this and that. But very aristocratic way of life, polished shoes, starchy clothes, Mercedes Benz, huge flat at Hiranandani, Hawaii. So this was the kind of impression, and I gave him lycopodium in LM potency, and the son said his general condition is so bad, we don't want to start chemotherapy because of the previous bypass surgery. You can't give chemo to people whose heart is weak. I said, फिर lycopodium चलाओ. Unfortunately, now see the chain of events in Bombay Hospital. Bombay Hospital has got 2 buildings, 1 and 2, and then there is a bridge which connects 2 buildings. He had to be taken for some X-ray or some for MRI, I don't remember. He was on that stretcher with the wheels. The ward boy lived in a Olympic way, and he fell down. And fracture of the pelvis, fracture of the Now, we can't operate your father. His heart is weak. So now what should I do? The poor son, who is a cardiologist, is helpless. He says, what should I do? They are not ready to operate, so painkiller and this and that. Worst part, kidney was weak. So he didn't want to give much painkiller to his father. So he said, Abhi dekho yaar, I can't now give lycopodium more because this bloody injury has come. 4 days of injury I treat with arnica and symphytum. He becomes extremely drowsy. And he starts murmuring. laboring, immediate CT scan, subdural hematoma. अभी pelvis को देखो, कैंसर को देखो या सबड्यूरल हेमेटोमा को देखो. नक्सोमी का, आर्नी का, सबड्यूरल hematoma. Then his urine stops and they have to catheterize the urine from the bladder puncture. They say prostate is the cause of it. Urologist said best thing is to do TUR or put indwelling catheter permanently. अरे माँ क्या तकलीफ लेके आया ये आदमी? You understood? I said don't do this, because if Foley's catheter will give problem every 6 to 7 weeks, You need to change and then infection and then this a headache. So, क्या करूँ? I put him on digitalis. Still subdural is there, still fracture pelvis is there, still cancer is there. In next 3 months, I am just going from pillar to post, treating this man. He says, just make my dad strong enough so that he can take chemo. Of course. But I told him that how much chemo is going to help your father in this situation, So, somewhere you have to decide. So he said, okay, the family will take a decision, blah, 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 because I told you he's a dominating guy. And I said, to hell with other things. Fracture will heal on his own, correct? Prostate was around 50 grams, so not very big, because 30 grams is normal. I said, if there is a suppression of urine or retention of urine, you let me know. We have got some wonderful remedy. So I normally use Pareda Brava in low potency, 3x or 6x, when there is a retention of urine due to prostate. So I said, keep that in mind, keep it with you. And I started treating with glycopodium, went higher, started ischiodot therapy, that is Viscamalb injection, which you heard yesterday, because they could afford ischiodot injections. And in around 5 to 6 weeks, after I saw, he was in hospital for 5 to 6 weeks, he came back to his Bombay residence because there were no more complications coming up. CT scan showed that subdural hematoma went away. You follow? Now we are only worried about the metastatic part and the cancer. So in the beginning there was no appetite and loss of weight, but when cancer was diagnosed, shortness of breath and coughing. And then Powai area has got Powai Lake, near Hiranandani, so strong winds and all those things, the poor guy developed pneumonia. So they said, we want to admit him in Bombay hospital. I said, aisa mat karo. Pneumonia we can treat in the house homeopathically if you have faith in homeopathy. So his wife and his daughter said, okay. So I went to Powai and I took his totality and I put him on chelidonium for pneumonia. 7-8 days took, chelidonium was better, followed by pneumococcinum because he had terrible weakness after pneumonia. Appetite and everything went down, so pneumococcinum. After 1 month, recovery from pneumonia. But then again, still the cancer remains. Remember that. So I said he had 2 symptoms, shortness of breath and all those things, and coughing. After 6 months, cough occasionally. In between also he had some hemoptysis, blood from with the sputum that we could control. Nothing great extra was given to him. And then after 6 months he died. I don't know how he died, but in the morning he couldn't open the eyes only and they found him dead. So maybe in the night only. But look the journey of 6 months with that family.